Marion Safety Council's take on starting the meeting up. So welcome everyone, both from Delaware and from Marion, to our October joint Safety Council meeting. We are very happy to be joined by Todd Jenson, Compliance Assistance Specialist, for an OSHA update. I believe Todd is from the Toledo office. Is that correct?
Toledo, Cleveland. Cleveland now.
Cleveland.
Desk in Toledo. So.
Excuse me, Matt. It's
Yes.
not letting me. It's only allowing me to invite.
Okay, I'll just keep watching it and click.
Yeah, I'm sorry.
Here.
Well, it's not giving me because I think it's because I'm not a host.
No worries.
Sorry.
Before Todd starts, I don't see Laura on. John, did you have any BWC updates you wanted to provide? John McLean?
Yeah, I can give them. I mean, we have some classes in October, or webinars, I guess they are. October 6th, yeah, today, we have the emergency action plan. It's a replay. October 13th, we have the new BWC website and other great online resources from us. October 20th, they got it listed as a self-study week. And October 27th, reducing injuries using ergonomic concepts. Just go to our call your local office and they can get you admitted. Or you can go online. We are going to start to offer some virtual training classes, half days. Those should be listed or coming out pretty soon. Our Congress next year is going to be completely online. And that's all I have right now, Matt.
That makes sense for the completely online. John, thank you so much for the updates. And with that, in the essence of time, I'll have Todd, start us out here this morning.
Hey, sure, I'm unmuted here. All right. Hey, I appreciate everyone getting on this morning, Monday morning early here. My name's Todd Jenson. I work with OSHA. I cover Northern Ohio now. My desk is in Cleveland, but my desk is in Toledo, but I report to Cleveland. So I have had 21 years with OSHA, inspecting chemical plants, refineries, steel mills, heavy manufacturing, and so forth. And I just recently took the compliance assistance job to do the public outreach. So welcome everyone to this. If you hear a kid in the background screaming they can't get on their Zoom call, that's my kid. So I told them to be quiet while we're doing this. So let's see here. I put a presentation together. It's some basic OSHA update information. And then I'll be adding things to it just verbally as we go through this. And at the end, I'll talk a little bit about COVID and what OSHA is seeing with COVID and some of our regulations that apply in this this crazy time that we're in, and what we're seeing out there as far as deficiencies in various industries. So let's see if we can get this thing going here. Just real basic stuff here. OSHA's in Region 5. For those of you that aren't with us, hopefully you're not familiar with us because you never had an inspection because you got a good safety program. But we're in Region 5, which is Minnesota, Wisconsin, Illinois, Indiana, Ohio, and Michigan. And I cover Northern Ohio for compliance assistance outreach. Right now, OSHA has two different kinds of inspections that we're doing. We call them unprogrammed and programmed. Unprogrammed activity is things that we do that just kind of pop up that we don't plan on. And those are the imminent dangers, fatalities, and complaints and referrals that come into us. We're still getting a lot of fatalities out there in Northern Ohio. I think we have in Region 5 right now 125 COVID fatalities that we're investigating. A lot of the COVID fatalities are in healthcare, nursing home, hospitals, social work, assisted living. We are seeing some COVID fatalities in general industry, service industries, and so forth. But I would say probably 90% of them are in healthcare and nursing homes. And we're seeing COVID fatalities with maintenance folks, receptionists, screeners, dietitians. I mean, it's all over the board when it comes to healthcare. And like I said, we have had some in general manufacturing as well. But we're out there, we're doing inspections. We're in the factories again, manufacturing, doing inspections. For a while there, we were only doing really construction sites because we could maintain the social distancing and all that. But now we are getting back into manufacturing, doing amputations and so forth. Program inspections that we're doing are inspections where you get put on a list and we take your name off the list based on whatever it is that we're trying to enforce, whether it be silica, beryllium, chrome, whatever it may be. We have a lot of emphasis programs out there, and companies get put on a list based on their SIC codes. And when we randomly inspect folks off those lists for those various types of hazards, what we call a programmed activity. Another example of programmed activity would be an SST, which is site-specific targeting, and those are based off injury rates. We have a number of emphasis programs right now. We have an emphasis on amputations, combustible dust, excavations or trenching, federal agencies, hex chrome, chrome 6, lead, PSM, silica, shipbreaking, trenching. These are our national emphasis programs. So these are emphasis programs where we go out and do inspections because Washington, D.C. says we have to come out and do these things based on accidents that they've been monitoring and so forth throughout the United States. But amputation has been on the list for a long time. We're continuing to do amputation inspections. So if we come out on a complaint, we're going to ask you if you have different types of equipment that cause amputations, presses, lathes, CNC machines, things like that. And if you do, then we may expand our inspections to include those machines just to verify that the guarding is adequate and that your lockout tagout policies and procedures are being followed. Combustible dust is still a big problem out there. We do a lot of combustible dust inspections every year, and with wood dust, plastics is really big now, and so forth. So if you got dust in your facility, get a hold of BWC and try to get some guidance from them, or you can call us on what you should be doing with combustible dust. Some of these have been on there for years, like the lead, silica. Those are still emphasis programs for us. So if we come out there and you do have silica and so forth, we will be expanding to include those as part of our inspection, just to make sure that you got a handle on everything you need to have a handle on. In addition to those emphasis programs from Washington, we do have local emphasis programs we've developed for the state. Fall hazards, grain handling, power industrial vehicles, and then building rehab. Building rehab, we're getting into a lot of asbestos and silica, fall hazards, and so forth. So if you're in an industry where you have these types of hazards, OSHA may pay you a visit just to make sure that you got your programs in place, your training in place, and that these hazards are being controlled in your work area. And I know that says 2018. These don't change year to year, so I probably should have said 2020 on that. But heaven forbid you do have a fatality, you do need to report that to us within 8 hours. If you have anybody that's hospitalized and it's work-related injuries, you got 24 hours to report that to us. Some of these COVID cases, the reporting sometimes is straightforward, sometimes it's not. But just remember, you got to report the fatalities within 8 hours and any hospitalizations within 24 hours. Anytime there's an amputation, loss of eye, those all have to be reported to us. Even if it's just the minute end of a finger, they still have to be reported to us. There's some phone numbers you can call to report those. You can get those off our OSHA website, or you can call your local OSHA office to report any amputations, hospitalizations, or fatalities. If you call a 1-800 number, it'll go to DC and then get forwarded to our office. But those are available. I always tell folks just to call the local OSHA office. On-site consultation is out there. BWC is out there for folks to take advantage of to help you come into compliance with OSHA's requirements and protect your employees. Their services are free of charge. And so people always ask me, do I call BWC or do I call OSHA on-site? And I say call both. The more eyes you have going through your facility, the higher the likelihood of spotting the different hazards in your facility. Every inspector has the little things that they like to concentrate on, and no inspector, even though nobody is good at every single thing. So I always tell folks to get as many folks to your facilities as you can to identify those hazards, because everybody's going to see something different. And on-site consultation and BWC, they can provide they can help you with health and safety programs. They can provide training for your employees. They can do air monitoring for you. They can do a lot of stuff for folks, and I highly encourage folks to give those folks a call. Like I said, there's no charge to the employer to call them, to have them come in and get them on the straight path. We do have a few programs out there, OSHA does, where we partner with companies. We have alliance programs. Usually those are with national organizations. We have a number of those in Ohio, where we partner with national organizations to get information out to their memberships. We do speeches for these organizations, and in return, it's a cooperative thing. They work with us as well. And then we also have partnerships. We have partnerships with individual companies or individual construction sites to enhance their health and safety programs and to work with them to keep employees safe. The pinnacle of safety and health programs is the VPP program, or the Voluntary Protection Program. And that's a program we have for like the best of the best when it comes to health and safety. I think we got 30 or 40 VPP sites in Ohio that are certified by OSHA, and it goes all the way up from General Electric all the way down to a small plastic injection molding company. So VPP sites are a whole range of industries, but it's a certification we give for exemplary health and safety program administration. We have an OSHA challenge program. That's kind of like VPP with training wheels on it. You know, we put you through the challenge program to get your health and safety program up and running, and to get you on that path towards having a decent program. And then if you manage to go through challenge, then you may be eligible for a VPP program down the road. And then on-site consultation has their SHARP program. We see a lot of companies in the SHARP program in Ohio. A lot of companies take advantage of that. And if you're interested in any of these programs, contact myself or on-site consultation, BWC, and we can get you some information on these. It's a good working partnership between OSHA and the other entities in Ohio, like BWC and on-site, to really help folks that really want the help. Talked about alliance programs briefly. We got a lot of Spanish resources. We just got a lot of Spanish publications in Northern Ohio recently delivered to our offices. If you have Spanish-speaking employees, make sure you reach out to us, and we can get you some of these pamphlets and these informational materials to you. They're also available on our website for download. So, like I said, there's 800 different Spanish language resources on our website. We have OSHA QuickTakes. You can sign up for QuickTakes, and what this is, it just emails you, I think it's like a weekly OSHA update, basically, on what we're doing, the citations that we've been issued, information we want to share with the public on COVID or false stand downs, or cybersecurity month, anything like that. The OSHA QuickTakes are a good resource just to get a little memory jogger in your email. And they're free. They don't cost anything. You just need to sign up for them on our website, OSHA.gov. COVID-19. So COVID, obviously, everyone knows about COVID. We like I said, we got 123, 124 COVID fatalities in Region 5. Chicago has a lot. And then after Chicago is Ohio. Ohio has quite a few as well. We're seeing a lot of it in healthcare, but we're also seeing it in manufacturing, some construction, but not too much. But COVID-19 is something that's going to be with us, I think, for a while. And after COVID-19 is gone, year, 2 years, whatever it is from now, it's going to be something else after that. So, but right now it's COVID-19. It's really causing a lot of problems for everybody and in their lives and everything that's going on out there. The biggest thing that OSHA is dealing with COVID-19, and we had a presentation on this with the Ohio Healthcare Association the other day. The biggest thing is determining work-relatedness of COVID. Because if someone gets COVID in the workplace, it's considered a work-related injury and illness. And so people are always asking us, well, how do I determine if my employee contracted COVID in the workplace versus out in the community when they go home or whatever? And so OSHA has put out a guidance memo on helping employers determine whether COVID-19 is work-related or not. Now, the guidance memo isn't 100%. We're not talking about genetic testing or anything like that. It's not 100%, but what the memo directs the employer to do is to number one, do a good faith, and the key word is there a good faith, investigation into how that person contracted the COVID. Questions that we ask when we go into places are, is there anybody else in the work area that has COVID or symptoms of COVID? Anyone tested positive? What are you doing to maintain social distancing? Are you doing health screenings for employees when they come in the door? For healthcare, the big question is, do they take care of COVID positive patients or suspected COVID patients? So there's a whole slew of questions we ask about what it is that the employee is doing and what they're exposed to in the workplace, in helping us determine whether a COVID infection is probably work-related. And I emphasize the word probably. Anytime you make a determination like this, you're not 100% sure, okay? But what you need to do is you need to ask those questions to determine what the likelihood is that they could have gotten COVID in the workplace versus at home. Now, if they're going to biker rallies on the weekend and playing on sports teams and doing all this extracurricular stuff, that's one thing you need to take into account when you're asking these questions. But at the end of the day, you're going to have a list of everything they're exposed to at work, everything they're potentially exposed to at home, and you have to make a judgment call on that. And what OSHA is looking for is your thought process. We've walked into some facilities where they say that any employee of theirs that gets COVID is automatically considered not to be work-related because COVID's so prevalent in the community. And what we do is we say, no, you got to back that up. You got to go back and you have to do a real evaluation. You can't do a lazy man's evaluation that's blaming on them being at home getting it. You got to look at what the risk factors are in the workplace, okay? And like I said, this is all detailed in a memo from May 19th, 2020, and this is all on the internet. What I would do is I write down May 19th, 2020, OSHA COVID memo, and Google search it, and it'll come right up. And it covers these things that I'm talking about, doing a good faith evaluation of the employee's exposure in the workplace versus their exposure at home, and determining what the higher likelihood is. And if you do this and it comes up, yeah, they probably got it at work because 4 people in their department had it at that same time. We're not doing health screening, we're not doing social distancing, or we're not requiring face masks, any of these things. It's all a weight-based system. You got to look at all the factors in making those determinations. And when we come in, we're going to ask you what your thought process was. How did you determine this? Okay. I know this is a big slide here with a lot of little print, but this is part of that memo as well. And I'm going to cover these 3 bullet points. We look at the reasonableness of the employer's investigation into work-relatedness. So we want to know what the questions are the employer is asking. We look at all employees that have COVID-19 in the workplace, how close they are to people that have had COVID symptoms or tested positive. How long did they work around those people? So forth, all these questions. And this memo goes down through there and details the questions that employers should be asking when determining the work-relatedness of COVID. It's a big deal because if someone dies of COVID, heaven forbid, whether it's work-related or not, it has a big impact on, number one, if you have to notify OSHA. It may have an impact on DWC. I'm not sure how the workers' comp stuff works with this. But if someone is sick and they have to be out of work for 2 weeks or go in the hospital and released or what. Anyways, they got time off that goes towards lost and restricted time on the OSHA 300 logs. So there's a lot of things that kick in when someone determines whether or not someone COVID is work related or not. So, and we understand that, but go through this memo. These are the questions that we ask. If you have any questions at all on COVID-19, make sure you contact your local OSHA office. I'm going to put my phone number at the end of this and give me a call. I sit on the COVID team for Region 5, which means me and a group of people review all the COVID inspection cases currently going on in Region 5. Okay, so we've seen a lot of different types of scenarios. Issues with KN95 respirators, issues with wearing cloth face coverings over N95 respirators, whether or not screeners have to have cloth face masks versus N95s. There's tons of situations, or wearing KN95s from China that are not anything more than just a paper napkin with some loops around them for your ears. I mean, there's KN95s out there that are counterfeit coming from China that are no good. They literally have a 25 to 30% efficiency rating on them instead of 95. So some of these KN95s is better wear a bandana over your mouth than wearing a KN95. So there's a lot of complicated issues out there with face coverings, N95 respirators, KN95 respirators, and it gets real confusing for the average HR director or even the safety director out there. If you got questions on any of these things, call me and I'll be able to walk through these issues with you, okay? Let's see here. So just real quick, just so the terminology is correct with everybody out there. I know in the news media and stuff like this, they use the wrong terminology all the time and people get confused. But an N95 respirator or an N95 dust mask or filtering face piece, whatever you want to call it, is a NIOSH certified piece of equipment. And if it's NIOSH certified and says N95, then it's gone through certain testing requirement that shows that it's 95% efficient against small particles. Now there's N95s, there's N100s, there's all different kinds of what we call filtering face piece or dust masks. The KN95s are ones being manufactured in China, South Korea. We even see a lot of them coming into Ohio from Mexico. It's basically a surgical mask is what it is. It may be a little more than a surgical mask. It may look like a dust mask, but typically the KN95s have the loops that go around your ears. You'll see a lot of people wearing those in like Home Depot, Myers, Lowe's, Kroger's, places like that. Some KN95s are good. They'll protect you. Some KN95s ain't worth nothing. Like I said, the efficiency rating's 30% on some of these things instead of 95%. So you're not getting very much protection at all when you wear them. I should say, you're not providing very much protection even for the people that are around you, okay? So there is lists of these counterfeit respirators out there that I can point you to. So if you are using KN95s, make sure you check that they're actually providing some sort of protection versus giving you a false sense of security. Face coverings, those are the cloth face masks that you can buy or face masks that are made on Facebook or the internet that you buy. Face coverings don't protect you, they protect other people. Okay. We see a lot of people wearing face coverings, the cloth face masks over the N95s to try to extend the life out on these N95s so they can wear them longer. Once you do that, you void the NIOSH certifications on them. So just keep in mind, you got these three types. You got N95s, KN95s, and then you got face coverings. Another one in here you have is surgical masks, and surgical masks are what we consider face coverings. If you require an N95 or a KN95, it is required that you have a respirator program in your workplace. Nursing homes got caught off guard with this because they typically are not environments where respirators are required. And when COVID hit, they required everyone to wear N95s, and they didn't put into place written respirator programs, and some manufacturing facilities as well. Anytime you require an N95 or KN95, you have to have an OSHA respirator program. which includes fit testing, medical evaluations, and training. And what we're finding is when COVID hit, employers got real nervous. They got desperate. They were trying to get anything into their facilities that they could. They'd order them from Belgium if they could, just to get something to put on people's faces, which is good. You know, something's better than nothing. But when you get something like an N95 in, you slap it on a person, or you give it to them and say, "Here, wear this." Anytime you're in the facility, you get kicked into the respirator program. And a lot of people don't have anything that OSHA requires for this, and we're issuing a lot of citations for these. So fit testing supplies are, in some areas, they're hard to get.
Todd, real quick, do you have can you provide us examples of some of the written programs, or after this meeting, or do you have?
I don't have anything on me, but there are examples that I can send you, and then you can distribute to your members. Or if they want to go on OSHA.gov, there's some examples of some respirator programs that they can download and fill in the blanks and so forth.
Perfect, thank you.
Respirator programs don't have to be very lengthy. Usually they're anywhere from 3 pages to 10 pages, depending on how complex the system you have. But yeah, it's something that most people can put together just by looking at some of the templates and stuff that we have out there. But they can be downloaded on our website.
Thank you.
Fit testing supplies sometimes are running low, but recently I think fit testing supplies have been fairly adequate. But the big thing is the medical evaluations. You know, if you require N95s, you got to have that employee fill out a medical questionnaire. And then that medical questionnaire has to be evaluated by a doctor to determine whether that person can wear an N95. I can tell you personally, when I put an N95 out on my face and go out and work in the yard for 2 hours and it's 90 degrees outside, you can feel it. I mean, it wears you out wearing one of those things. If you're out digging a hole or mowing the yard, whatever, with a dust mask on, I mean, it takes a little toll on you. It's difficult. And if you have high blood pressure, heart conditions, asthma, or some underlying health condition, just something as simple as wearing an N95 could be something to put you over the edge and cause you a lot of serious medical problems. So, like I said, I've noticed it myself just wearing one of these things. They're uncomfortable and it's hard to breathe through them, and they wear you out real quick. But medical evaluations have to be done. And the employees have to be trained on these things, how to inspect them, how to put them on properly without contaminating them with COVID, and the signs and symptoms of things to look for when they're wearing these things. So respirator programs are required. It's an important part of it. If you don't have a respirator program and you're requiring N95s, give me a call, give BWC a call, give Onsite a call, and we'll get you going down that path to get one developed, and so you'll be in compliance with our regulations. So we have a toll-free number. Let me give you my phone number. It's a Google Voice phone number that I use. And if you call me, I'll take your information down and I'll get back to you that day or the next day. And if I don't know the answer, I'll call Chicago or DC, or I'll get someone that does know the answer for you. But I should be able to answer most of the COVID questions you have, or even just compliance in general, whether that's fall hazards in general industry or construction, or beryllium, silica, whatever, PSM questions, whatever it may be, I should be able to help you out. My phone number is 734-531-8015. Do you guys have a chat function on here? Maybe somebody could put that in the chat.
Already done.
Already
All
done.
right, 734-531-8015. That's my Google Voice phone number. We're all working out of our homes right now. So if you call my desk number, you're not going to get anybody. Probably won't get anybody until after January. So, but you'll be able to get a hold of me on that number, and I'll be able to walk you through any compliance questions that you have over a whole slew of topics. You got a machine guarding question, I may say, hey, email me a picture of that machine so I can take a look at it and so forth. But OSHA's here to help folks out. We're not just out here to roll into a facility and surprise you and ding you and issue a lot of citations. We're here to help folks out. We want folks to get things fixed so we don't have to come out there. So people don't get hurt or people don't file complaints. So give us a call. We got people on the phones all day long, every day. They do is answer questions from the public. And I always tell folks, if you call me up with a question, I'll give you an answer. you can write my name down, the date that I told you and what I told you, and I'll stand by it. So that's about all I got. We're out there, we're doing inspections in general industry and construction, maritime, agriculture. We're doing our normal stuff out there. When we come in and do an inspection, we are asking basic COVID questions for the workplace just to make sure that we're safe, making sure you don't have any COVID positive employees and so forth. We're doing a lot of our interviews over the phone. We're not doing very many in-person interviews. Usually when we go on site, we're only there for maybe half an hour and then we're gone, because we're limiting our exposure to in certain work areas. So a lot of these inspections we're doing are over the phone with the employer, phone interviews and so forth. And I see that continuing on well after the first of the year. So most OSHA offices are closed down right now, but you can get a hold of someone if you call them. Our compliance officers are working out of their homes and going out from there. So and these are strange times, and I think these Zoom meetings and Microsoft Team meetings are probably going to be with us for a while. So, but I appreciate you guys inviting me today, and everyone just stay healthy out there and stay safe, and we'll all get through this.
Thank you.
Thank you, Todd. Do we have any questions from anyone here in the meeting today for Todd?
Hey, this is Thad from Poet. Todd, appreciate the presentation.
Yeah.
Just for Poet's ethanol plant here just north of Marion, PSM facility. We have had 3 recordables this year, unfortunately. But we have been always looking for ways to better ourselves. And out of the programs offered, we were thinking about the SHARP program, but I wanted, if the VPP, for things like, for a program like that, they really look for you to have less incidents than what we've had. So I just want to get your feedback. What would probably be the best program for us to participate in, being a PSM facility, having 3 recordables this year? What would be?
I think the SHARP program would be really good for you to get into and get your feet wet. BWC and Onsite do an excellent job with the SHARP program. Get into one of those programs, get up to speed with that, with the auditing and everything that's required about SHARP's programs. And then once you feel like that, hey, we got a pretty good handle on stuff here. Injury rates are low. BWC Onsite think we're doing a really good job with health and safety. Give me a call and we'll walk you through taking you into a potential VPP program. We also have partnerships too. We have with certain companies and construction sites where the company works hand in hand with OSHA. We may come out once a month and just do safety walkarounds, things like that. But I would definitely recommend the SHARP program up front, and then maybe VPP down the road. We like to get as many PSM facilities in VPP as we can. It's a tough process. We put folks under the microscope, but what we're looking for with VPP is safety and health management programs. We're not looking for perfect sites. We're looking to make sure that you have programs and systems in place to identify hazards, to fix things when they come up. That's the important part, because no place is perfect. I mean, I can go into any place in any VPP site and find problems, and that's not the issue. It's you have the systems in place to address these problems when they come up.
Thank you.
Yep.
And Todd, you are efficient in everything you do here, the presentation, and apparently you knocked out 2 questions at once there. So great job there. Any other questions for Todd? Seeing none in the chat or hearing none, then I think we'll conclude our presentation for today. Thank you again for joining us all, both from Delaware and from Marion Safety Councils. We will do this again next month, November. Gosh, we're getting there. So it'll be the Delaware Safety Council to kind of host for that one. So maybe you'll see those awesome slides come back again that we had from last month.
Thank you for calling us awesome.
We'll see.
In a very weird way. Thank you, everyone.
Thank you, Todd, again.
Marion, be safe.
Thanks, everyone. Thanks.
Bye.